Hi everyone, a very good afternoon. Welcome to today's webinar, Discover Monash, focusing on the areas of radiation sciences, radiography, and medical imaging. So here with me today, I've got Laurie and John, who are currently teaching into those two programs. We've also got our graduate student, Mackenzie, as well as our current student, Nicole, who will be sharing more about their student experience. So before I begin, I would wish to acknowledge the people of the Kulin Nations on whose land we are presenting from today. I pay my respects to the elders past and present. And with that, I'll pass the time on to Laurie right now, who'll be telling you more about the radiation sciences degree at Monash. On to you, Laurie. Thank you.
Great, thanks, Sherry. Can you stop sharing your screen so that I can share mine, please? Great, thank you. Okay. Hi, everybody. I'm Laurie Boyd. I'm one of the coordinators for the Bachelor of Radiation Sciences course here at Monash, and Caroline Wright is the other coordinator for the course for us. And it's a great pleasure to be here today and just telling you a little bit about our course and what's involved. So the Bachelor of Radiation Sciences, it really is about scientific and technical expertise, but also an understanding of radiation sciences, medical radiation sciences, and other parts of the healthcare system in Australia, and some of the fundamentals of patient care, such as, good care for our patients, understanding vital signs, for instance, understanding some of the ethical issues that may arise in practice. So all those aspects of being a health practitioner. Just some of the subject prerequisites you'll need to get into that. You can find all of that information on the Monash website, so take a look there. But you do need to have English and Maths. And I've put the ATAR there, and that's the lowest selected ATAR rank for which an offer was made in 2022 for the course then. This is a bit of a busy slide for you today, but this is what the course is all about. This is what you study. So in year one, you'll be taking a lot of the fundamentals, the foundation courses or units. So you're going to learn about anatomy and a bit about physiology as well, what research in health is all about, how IT informs health and society, and radiation physics, which is one of the units that will prepare you for some of the units that you do later on, that you have to have that understanding of the physical properties to understand the equipment and the technology and the safety for patients. That's for semester one. And in the second semester, we build on those semester one units. So you continue with anatomy and physiology. You learn a little bit about epidemiology, so learning about disease processes and how disease plays out in the population, what the healthcare system in Australia is all about, so how it's structured, how it functions, and then continuing on with the physics and learning some more about the radiation physics and physical principles. So that's year one. In year two, we build on the anatomy and physiology and look at pathophysiology. So that's getting into some of the diseases that you would find. We're going to look at a specific course which looks at cancer and its management and gets into radiation therapy, which we'll talk about a little bit more when Mackenzie comes on. We have a unit that is about professional skills. So that unit actually has a strong focus on providing healthcare for our Indigenous patients in Australia, but as well, lots of other different types, older patients, younger patients, pediatric imaging, things like that. And then we have anatomy, but that is specific to imaging. So looking at CT, looking at MR, looking at plain film imaging, and how these show on an image and how you can pick out the different pathologies and the different anatomical parts there. We build on the pathophysiology with a second unit in semester two. Then we look at actually radiographic principles here, and then the second course in professional skills, which looks at some of the other practical skills, how to start an IV, how to take vital signs for patients, all those sorts of supports that we can provide for our patients. And then we look at another imaging modality, which is nuclear medicine. Year 3 gets more focused, and when students get into year 3, they've really made a decision on where they want to go and what sort of course they want to follow. Some of our students will take the pathway into radiation therapy, where they can do an accelerated master's in radiation therapy. And Mackenzie, I'll tell you about that because she's enrolled in that right now. But some of our other students, about probably half of them in the course, will decide they may want to pursue other postgraduate healthcare options. So they will take some of these units, which are electives, to prepare them for that, such as some of the occupational therapy units that are OCC units there. We're continuing on with some of the imaging there. We have a CT, so computerized tomography unit. We have a magnetic resonance imaging unit and an ultrasound unit as well in semester 1. And then in semester 2, we have electives as well, and then some units that are specific to radiation therapy. So that's what it is. It's a 3-year course, and you study all sorts of different technical, scientific aspects, anatomy, imaging, patient care, all of those things to prepare you to either enter another program on completion or find work in industry as well. So what's a program all about? It's blended learning. So you will learn with online learning as well as classroom learning. We have tutorials, we have recorded lectures as well. And all of those come together to help you understand the material and the content that we teach. And there are different ways that are better to do different types of learning. So in the tutorials, it's really applying the knowledge that you've gained and looking at some of the recorded videos with more of the theoretical knowledge. So that's what you're going to do in different ways as well. The years I talked about, years 1 and 2, those are the foundation studies in radiation sciences. And then there is a clinical practice and simulated learning when you get into years 2 and 3. In years 2, there are site visits in nuclear medicine departments. And in year 3, we have short site visits to MRI departments as well. And then in year 3, we have the radiation therapy treatment planning, where you actually, when a patient has cancer, they're actually planning the types of treatment that would be applied depending on the type of cancer that they would have. And then those students who are doing the pathway into the Masters of Radiation Therapy would do a 1-week clinical orientation at a cancer center, and that would happen between semesters in their 3rd year of study. So it's a 3-year course, and you're understanding the science behind all sorts of radiation and imaging modalities. So radiation therapy, radiation physics, image processing, and the radiation treatment as well. And learning about the patient care in the Australian healthcare system. You're going to learn about some of the latest technologies like MRI and CT, and look at 3D treatment simulations. And you're going to learn how to use radiation therapy planning and all types of different medical imaging software, such as CT or computerized tomography. As I mentioned, there's a lot of opportunity to go on to different studies, and lots of our students do. The electives that I mentioned in the previous slide were only introduced a few years back, so our students are just starting to pursue different areas of study, and that's because we've increased the numbers of students that we take in each year. Probably, as I mentioned, about half will go into the Master of Radiation Therapy. And that ends up being about 20 to 30 students on average. And we might have a cohort of about 40 to 50 by the time the students graduate in year 3. Another unit or course that the students sometimes apply for and pursue is the Masters of Medical Ultrasound. And that's a Monash course as well that's taught here. We have the Master of Public Health. A lot of the units that you take in the 1st year of studies would be units that are in the public health department. And there's lots of different areas that you can work in public health, different research areas, helping with the administration or government roles. You might think of COVID lately, lots of public health jobs in what went on during the time when we were trying to manage COVID. Another area is the Masters of Occupational Therapy Practice. So that's really helping people to lead their fullest lives and get back into the workforce or parenting or all sorts of different things. The occupational therapist would help them learn to navigate that, perhaps after a person may have had an injury there or a disease process going on. There's also the Master of Social Work, and that's often working with families and people in need of help through various organizations. So that's another area that our students pursue. And then a couple of fairly new ones is the Doctor of Physiotherapy. So when you graduate from that course, you would become a physiotherapist. So working with patients who have musculoskeletal injuries and helping them in their recovery from that. Or a new one, the Doctor of Podiatric Medicine, and that's all about feet. You may not think about it, but it's a very important part of how we function. And there's lots of things that can go wrong and can need support, whether it's making orthotics for patients who have problems, or designing special shoes, or just helping patients or people with their gait. So all sorts of interesting things happening there. So those are a number of the different postgraduate courses that you can pursue after you graduate from the Bachelor of Radiation Sciences. So just one thing to make sure that you understand, the Bachelor of Radiation Sciences is not a course that will lead you to start working right away as a healthcare professional. You need to do other courses afterwards, such as these master's and doctoral programs that I'm showing you here. So when you graduate, you, for example, would not be a radiographer, such as John's going to talk to you about. You'd have to do other courses to become that. But you can work in the healthcare system. There are lots of jobs in the healthcare system. There's lots of jobs in industry. There's research jobs, and all of these graduate programs you can take as well. So lots of different opportunities for you after you complete the course. So again, each of these courses would have prerequisites. We do make sure that our units within the program would meet the prerequisites, but you would also have to meet the grade point average or get the required mark to get into these courses. And they are competitive as well. So just so you're aware of that. And that's it for my presentation. It was short, but there's lots of information, and we hope you'll be able to come and visit us on open day to actually see our facilities and our classrooms as well. And I'm going to hand it over to Mackenzie. Mackenzie is a graduate of the Bachelor of Radiation Sciences, and Mackenzie is now in the Masters of Radiation Therapy. So she's going to be able to tell you about that aspect, studying that aspect, also what it's like to study in the Bachelor of Radiation Sciences, and just give you a bit of a perspective from a student's perspective in that. So I'll hand it over to you, Mackenzie. Thank you.
Thanks, Laurie. Hi, everyone. As Laurie said, my name's Mackenzie. So I'm 21. I'm originally from country New South Wales. I moved to Melbourne all the way back in 2020 to start university here at Monash. So all the way back in 2019, I was in a similar position to you guys, wondering what I was going to do after school. I knew I wanted to do something in health, but nursing and medicine didn't really appeal to me. I'm not very good with blood and guts and that kind of stuff. So I didn't really know what area of health would suit me. So when I was in year 12, I came across the area of radiation, radiation therapy and radiography. And I thought it would be the perfect match for me, as it's an area of health where you get to help people, but it's also got a lot more technical sides. You get to operate machines and use computers a lot. So in the end, I decided to go with the Bachelor of Radiation Sciences, as Laurie has just discussed with you guys. So in terms of the classes and the class work, so most of the units usually have online content that you work through in your own time. So it's like readings, lectures, videos, and this usually takes a few hours each week for each subject. And then you usually have 1 or 2 classes a week for each subject, and these are usually 1 or 2 hours long, and it gives you an opportunity to ask questions to the staff and also get feedback and work with your peers. So in terms of the workload, that does increase throughout the degree, but I still think it's very manageable. So I work part-time at the same time as uni, and I have no problem keeping up with the content. As long as you have a study schedule, you'll be all good. So in terms of hands-on experience, a lot of the units also have laboratories or practical classes. So my degree will be a little bit different to yours because the first year of mine was fully online thanks to COVID. But some of the practical things I did get to do throughout my degree include, we had labs where we did a lot of stuff with Bunsen burners and like looking at cells and cancer and disease under microscopes. We also got to do like testing to see what blood type you are. We do a lot of role play, like pretending we're patients, work on communication skills. We got to do ultrasound scans on each other. We also did classes on how to use the radiation therapy equipment properly, and also just general medical equipment like wheelchairs, which is pretty fun wheeling each other around. So as Laurie explained, you get the opportunity to choose electives in the last year. And I chose the elective that gave me the opportunity to go on a 5-day placement in a radiation therapy center. And this really helped me figure out that radiation therapy was something that I wanted to do. And it also gave me the chance to see what we'd been studying in real life and see how patients actually receive radiation therapy. So overall, my favorite thing about the degree is definitely the people. Radiation therapy and sciences is quite a small degree. And so I knew almost everyone in my class by name, and it makes it super easy to make friends. And for example, I still catch up with my friends from uni. We always study together and we do the social things like balls together. The staff are also super amazing. So you've heard from Laurie already, but they're super, super supportive. And they're always there for you to help. And also because it's, again, a smaller degree, most of the staff know you by name. So for example, even last night I was doing a test and I got locked out, and I emailed my unit coordinator, and he was super, super supportive and helped me get straight back in and very understanding. So all the staff are there to help you out with any problems that you have and if you're struggling with any content. So what happens now for me? So after the Bachelor, the great thing is that you can go on to study a lot of different areas, as Laurie mentioned at the end there. But because I really found my passion in cancer care during the degree, and also because of the placement that I did, I decided to go down the path of becoming a radiation therapist. And essentially what this means is that we treat people's cancer, like instead of using chemo, we use radiation. So this involves a lot of things. So we first have to do CT scans, of the people's cancers. Then we also use a wide range of like software and computers to create their treatment. And then we're also involved in delivering the treatment. So you may have seen in Laurie's slides the photo of like that big machine. That's called a LINAC, and we use that to deliver the people's radiation plans. In terms of what it looks like for the patient, so the patient usually comes in 5 days a week for treatment over multiple weeks. And this is one of the reasons why radiation therapy really appealed to me, because you're seeing the patient so much, so you're able to build like a rapport with the patient. And I find that really, really rewarding. You also get to work with a wide range of health professionals, like doctors and nurses, speech pathologists, physios, anyone that's really involved in cancer care. And I'm currently doing the Masters of Radiation Therapy here at Monash. So the Bachelors of Radiation Science has greatly prepared me for this, especially because most of the Masters is a placement and hands-on learning. And I feel like because we cover a wide range of things during the Bachelors, I'm very well-rounded. And I'm also, because of all the practical classes that we've done, I feel very comfortable and confident in using the equipment and also communicating with the patients and the healthcare workers. So I would recommend the Bachelor of Radiation Sciences to anyone who's possibly considering a career in healthcare, but specifically if you're interested in cancer, radiation, or anything along those lines, because it is a super rewarding career. It is also pretty cool to tell people that you study radiation. So that's also a huge plus as well. But yeah, thank you so much, guys, for listening, and all the best with your future study.
Thanks, Mackenzie. We'll pass the time on to John right now. But in the meantime, if you've got any questions, feel free to post them via the chat function and we will answer them on the go, if not towards the end of the session. All right, on to you, John.
All right, fantastic. Thank you very much. So I guess everybody can see my screen and hear me. Okay, so my name is John McInerney, and I am the course coordinator for the undergraduate Bachelor of Medical or Radiography and Medical Imaging honors degree here at Monash. So I'll just run through again, like Laura, keep it nice and short, and then I'll pass over to our students. and we can hopefully have some time to answer some questions and so on. So, very much. So I'm going to look at the, like I said, the Radiography and Medical Imaging Honours degree, and this course is designed around developing the skills required to become a registered radiographer. So when I say registered radiographer, I can imagine many of you will have heard of APRA, which is the Australian Health Practitioner Regulatory Authority, where doctors, physiotherapists, nurses, and so on are registered. And at the end of the undergraduate medical imaging degree, you can likewise become registered with APRA at the end of the course, and the MRPBA, which is the board that governs radiography and medical imaging particularly. So what do radiographers do? I think some of the, it can be somewhat of an, I think, an underrepresented profession. We're a very small craft niche group. Our intake every year at Monash is roughly 80 students. There are 2 other universities in Victoria that offer radiography as well. So the numbers are quite small, and we're quite a craft group. And likely many of you will know plain x-rays that you'd see that you can get. You fall over, you injure your wrist, and there needs to be a diagnosis of whether you have a fracture or not, and what your treatment might look like in management for that. And so most of us probably know, pop in for an x-ray, plain x-ray, where we get a couple of images of our wrist or our hand and so on. But there are other areas too where radiographers work. And I think that's really, really important to recognize that fact, that radiographers are involved very closely in many of the theatre operating procedures that occur in the operating theatre setting, and the imaging being done safely is very, very key to guiding the surgery and so on, such that it will be successful. Another area where radiographers work is in the CT, computed tomography scanning, which is sort of like I guess an advanced form of medical imaging that has become just absolutely exponentially grown over the last number of years, and the applications of what we can do in CT imaging maybe particularly is just mind-blowing. Like lots of areas in medicine and healthcare, it's data driven, and in radiography particularly and CT, there are massive volumes of data generated and acquired, and these can be manipulated in certain ways by certain applications, how we view them and so on. So it's become, CT has become much more complex imaging, and the radiographers again are responsible for ensuring that's done safely. So we're looking at the image generation, and those images then will go to radiology for reporting. So that's the point. We are involved to there to ensure that the imaging is of good quality, performed safely, and obviously patient care aspects and so on as well. The other area that this course focuses on is magnetic resonance imaging, such that at the end of this degree, you can go and work in MRI as well. And again, it's quite likely that a lot of you will know what an MRI is, and so on. High, we've likely have seen it. High profile sports people in the AFL will they bend their knee during the game, and they will be getting taken for an MRI to assess the level of damage, and then that feeds into what their management, treatment, recovery, etc. looks like. And really the aim, I suppose, of the game is to generate diagnostic quality images safely for analysis and interpretation. So that's radiographers aren't responsible for the analysis and the interpretation of the images. They are responsible for the generation of the images. Of course, they're responsible for if they do see something on their image, they are quite capable and able in that regard, and they're often the first, I suppose, line of defense maybe in many ways, and they will highlight and flag suspicious imaging for reporting and so on. So I guess with radiography, partly I think it's like a supply and demand. We have very small numbers, and the course is popular with people. There's like a high employment rate, good career prospects, etc. And I think because of that reason, the entry requirements are really, really quite competitive with some prerequisites in there. Okay. The ATAR score, as you can see from 2022, is really quite high. It's, you know, almost in keeping with like sort of the medical degrees, physiotherapy, and so on. And again, part of that is that a system means that we have a certain amount of places, lots of very smart students from year 12 and so on interested in the course, and therefore that sort of drives up the ATAR scores. But it is quite a competitive entry, both for school leavers and also for if there's anybody who maybe considers like course transfers and so on as well. So this is a little like Laurie, quite a busy slide, but it sort of shows us where we kind of sit across the map of the course. And we operate across kind of 4 major themes where we look at in year 1, what are the fundamentals that we need to ensure that as a profession we are able and so on to integrate into like a complex healthcare system and so on. So you start to look at, we look at human biology, from, you know, anything from cellular structure that some of you will have like was learned in biology in school, up along to the Krebs cycle, pharmacology, etc. Also in that sort of year 1, year 2 time, the fundamentals of radiation protection and radiation physics are very, very fundamental to us being able to, again, ensure that patients are safe. Radiation is ionizing and therefore has potential for harm, and that's a very large part of a radiographer's role, is ensuring that you know, we operate within safe limits, and how we do that effectively and well. But embedded across the course, I suppose, is radiographic science and practice, which is the nuts and bolts of, well, how does one achieve an appropriately positioned series of imaging for a wrist X-ray such that they can be accurately reported on and get accurate diagnoses and so on. And then the other area of practice that is, whilst this map sort of maps it out as if we only look at professional practice in year 4, it is embedded across our course. We have both sort of a horizontal and vertical alignment across our course, that professional practice is very, very important, and therefore is embedded within sort of other units as well. But in year 4, we sort of do a very clear focus on that specific area, maybe particularly around the notions of evidence-based practice and research skills. Okay, and you'll also see just in year 4, there is a lot, well, actually, I'll look at the slides around our clinical studies, because I think that's always an important item to know that there are real world experiences inbuilt into our course along the way. And this is in our current state. In year 1, we have 6 weeks worth of clinical placement, and they start, and this is from our perspective a very important aspect to our courses, that we have a short, it's 2 weeks of clinical placement experience at the end of year 1, semester 1. So we get our students prepared early in the course to be able to safely go out into practice. And then that's important, I think, from multiple perspectives. One, a little bit like Mackenzie, when you alluded to your experiences in the elective earlier on, they help to consolidate, you know, your learning. They also start to, I suppose, help you to go, yes, do I understand what radiography is and how it looks like in practice, and sort of does it ensure that it still appeals to you, and so on, so that you can continue along your course. And then in year 1, semester 2, there's 4 weeks worth of placement. And we started the placement hours and sort of increase each year. In year 2, we have 8 weeks worth of clinical placement, 4 weeks in semester 1 and 4 weeks in semester 2. Year 3, we have 11 weeks worth of clinical placement, where there are 5 weeks of placement in semester 1 and 6 weeks in semester 2. And then in year 4, we have an extended, it's like a getting ready to practice long 24 weeks worth of clinical placement time in year 4, and that is designed, I suppose, to ensure that people, when they're enter into the workforce and are registered radiographers, they're able to be immediately in a very, very strong position to contribute to the healthcare practice in Australia as they are registered again immediately at the end of the course. Next then. Yeah, I guess the other item about clinical placement is we have on campus skills labs, we have some virtual simulated environments and so on. So we tailor those very closely to match, I suppose, what a student is going to be engaging with in clinical placement, so that the students can, I guess, make the most of that clinical placement experience, so that they are ready to hit the ground running when they get out of clinical placement. That clinical preparation part is very, very deeply seated within the course. We also have medical imaging, and it's maybe a little bit different from radiation therapy in that medical imaging happens in a quite a variety of settings, from major metropolitan hospitals down to some generally private practice that can operate even out of medical imaging clinics even in shopping centers. And so we are conscious that we want to provide students with a range of experiences in clinical, such that you can start to look at, what do I want my career to look like now? Where would I see myself working? For some people, they see themselves, wow, I had such a positive experience in a small clinical center in maybe an outer suburb of Melbourne, that's the kind of environment I want to work. Other people go, I just level 1 trauma center like Alfred Health or Royal Melbourne Hospital, that's where I want to work. And once you can go out and experience those firsthand, you can get a very real sense of what they look like. The other item, I suppose, is we have also, obviously, in Australia, a spread across all of Victoria into rural and regional Victoria, and we offer students the opportunity to get in to see those as well, and see how healthcare sort of works in those settings as well. Just, I suppose, a point of note, we have in the past had overseas placement opportunities in places like Singapore, the UK. We've even been to Botswana, Israel, Thailand, and we're in the, I suppose, currently recovering these post-COVID, such that this year, for example, we have a placement in Singapore. Next year, the hope is that we will re-establish with the UK and Thailand. So we have these really kind of good opportunities for people to get out and see what practice looks like on an international scale as well. Further studies opportunities, again, I guess all of the items like postgraduate study, like of a kind of a cognate discipline is open season. I've just picked up a couple of sort of ones that people tend to sort of go towards, specifically out of the undergraduate medical imaging radiography degree. The Master of Medical Ultrasound is extremely important or extremely popular, and a lot of people will find themselves interested in ultrasound. We do some initial placement experiences and learning within the undergraduate degree around ultrasound, but ultrasound itself is a postgraduate qualification. And our degree prepares people again to enter into that very, very quickly. The Master of Advanced Healthcare Practice, which Laurie spoke about earlier on, the postgraduate certificate in image interpretation is one that has, I guess, grown a lot in popularity. The Radiographer Registration Authority have put it in very plain writing that radiographers, in essence, are the first people who will see the images. They have the skills to be able to highlight significant pathologies that require prompt action, and are again bound when it's a regulatory direction. Then one is obliged. It's not a nice to have. You're obliged to what we commonly refer to as see something. You say something, you alert the appropriate people, and you communicate that message effectively. And this course really, really helps get in that regard to build confidence in that area. There's always the opportunity for research, independent research, Master of Philosophy, PhDs. We have all of the tools, resources, and people and expertise that if you were interested in pursuing that pathway, that we can provide that. And just an item that, like, I sort of like to add on to our conversation is that always think of an undergraduate degree. Maybe again, Monash's degree is Monash is a very well recognized university, you know, a really top university in the world rankings. We have an honors degree, and so the undergraduate degree for me is really just a stepping stone for you on your career. So the majority of people will come in and know that, like, I enjoy CT, I enjoy MRI, I enjoy ultrasound, and will find themselves within medical imaging, specifically generating quality images safely. But there are many other opportunities, and we're seeing, I think this is a real growth area for radiographers, as healthcare is just, it's so data driven now. I mean, you know, no public major center will have paper notes anymore, so everything is coded and ends up on our EMRs, our electronic medical records, which can be mined for all types of data. You know, a really interesting area is for example, what patients are likely to sort of have, for example, I don't know, a remission of their pathology, and we can mine data to go, well, if their treatment looks like this along the way, which of these people are more likely to sort of encounter further issues down the line. So radiographers are doing this in spades. We deal with data all the time, and we're very well positioned to speak to that. So we have several of our radiographers who have qualified in particularly the last number of years, are like involved in EMR analysis and so on. There's also just all of the imaging and so on is obviously all digital information, and it's stored on, we'll call it a PACS. It's a picture archival and communication system, which needs administration. And we find radiographers again find themselves now more and more in these positions where they're interested in that and go, you know what, I want to move away from maybe the patient interface and work in the back room in essence. Right? Applications, like I mentioned earlier on with CT, just an absolute explosion in the types of applications that can be applied to the data that's acquired. Diffusion weighted imaging, soft tissue algorithms, bony algorithms, etc. Dual energy CT and so on that can be out there. And that's a massive area for these huge companies, Siemens Healthineers, Canon, etc., who build all of these applications. They require somebody who's an expert in the field to get out there and assist centers when they purchase new machinery with embedding the appropriate applications and using them appropriately. And that's a big, again, area. It always has been, but again, we're seeing as more applications come online, people need more, and certainly Monash graduates are enormously well regarded in that instance. The head, just out of interest, the head of clinical, what is her title? Clinical equipment in the Australasia region is a radiographer who proudly identifies as a radiographer but hasn't taken an X-ray in several years. Also the area of governance. Governance is inextricably linked to patient safety. So whilst taking an image of good quality is important, the systems and structures within which that takes place need to be governed. And again, radiographers are finding themselves very, very well positioned to take up roles like that. And thank you very much. That's my last slide. I will hand it over to, we have Nicole, who is a final year radiography student, and we'll get, thanks, Nicole. I'll let you pick up the baton there. Thank you very much.
Thanks, John. So hi everyone, nice to meet you all. I'm Nicole. I'm one of the current fourth year students studying radiography at Monash. And today I'll just be talking about my personal experience of the course so far. So a little bit about me. So I chose radiography right out of high school, and I chose it for a number of reasons. First of all, I knew I didn't want a desk job, and I liked how radiography really keeps you on your feet. It's very hands-on, requires a lot of problem solving, working around different patient presentations. And you're also working with technology, which is continually evolving as well. And of course, I love working with the patients, which I find really rewarding. So right off the bat, something that I found quite unique to radiography was the small cohort size. So my cohort's about 55 students or so, and I know that some of the other cohorts below me is about 80, compared to other courses which might have over 1,000 students or so. So that means that we're quite tight-knit and we get to know each other really well. The lecturers also know us a lot more closely as well, and that makes us feel really well supported, and it makes it easier to address any queries or issues we have with the course content or personally as well. So in terms of classes, so classes vary slightly across the years, but I would say from years 1 to 3, it's pretty much 4 to 5 days a week of classes. By year 4, the timetable is a little bit different for us. It's a bit more relaxed and self-directed. And so we have about 1 to 2 classes a week, and also half the year is also our internship as well. So classes are comprised of lectures, workshops, tutorials, and practicals. So lectures are all about the content delivery. Workshops and tutorials are a bit more interactive. So we go through activities and questions with the lecturer, and we also work in groups. And practicals are probably my favorite classes. So we have X-ray rooms on campus, which are really functioning as well. So we also have phantoms where we can X-ray them, and they produce kind of accurate images of X-rays as well, and that helps us really hone in on our clinical skills. We also have a mobile X-ray machine, and that really helps us with our problem-solving technique, which we'll encounter in real-life practice as well. So speaking of hands-on experience, so Monash is really good with providing us with hands-on experience from year 1, like John said. So these range from about 2 to 6 weeks, plus our 6-month internship in year 4. So these are a large variety of locations all over Melbourne and interstate and internationally as well. But unfortunately, I didn't have that opportunity due to COVID. So for example, I went to a local clinic, a public hospital in the northern and eastern region, and a paediatric centre and cancer centre in the Melbourne CBD, and a public hospital in rural Melbourne as well. So I found that by going to different places, you really learn different things based on the location, as you're able to interact with a different demographic of patients. For example, when I went to a local clinic, that's when I got a lot of independence and confidence. And I felt that by the end of placement, it basically felt like I was running the X-ray room compared to a public hospital. So that's when I interacted with a lot of different hospital staff, and it involved a lot more teamwork as well. So I was able to see a lot more interesting clinical presentations and use a lot of problem-solving skills. So through these placements, not only do you get insight into what radiography will be like post-placement, but you'll also be able to see what kind of settings that you want to work in the future after you graduate as well. So building on from this, so I'll be interning with Monash Health next semester, and that's a public healthcare service. So I'll be rotating across 2 public hospitals, Casey Hospital and Moorabbin Hospital, which I'm really excited about. And I hope to work in a similar healthcare setting after I graduate as well, because I really like that variety in public health. Having been exposed to other modalities as well in uni, so especially in year 3, where you'll be learning about ultrasound, MRI, and CT, I'll also be excited to train into those modalities as well further down the track. Another tip I just have also for you guys. So I know 2 friends who actually did a work experience kind of placement when they were in high school. So if you're considering radiography and you're not too sure or just want to know more about it, I'd also recommend seeking out those kind of opportunities as well. So yeah, thank you for listening, and happy to take any questions later as well.
Thanks, Nicole. Sorry, John, we can see your screen. All right. Thank you. So we'll be answering questions right now. If you could all switch on your cameras, that would be great. All right. Most of the questions are already answered, but if not, just feel free to pop in whatever questions that you may have in regards to those two study areas for either our academics or our students. All right, so one of the first questions we've got is in regards to postgrad employment percentage. I can see that Laurie has already answered that. Perhaps, John, would you want to add anything onto that?
Yeah, thanks, Million. Yeah, Laurie answered it for the radiation sciences degree. So I'll answer it for our course, like the radiography and medical imaging one. So in effect, we have you know, a 100% employment record out of our course. Again, ours graduates will get registered immediately with APRA, and from that regards, they can go and work immediately within the sort of specific profession of radiography. And certainly our experience is that once one has completed a 4-year course, and we know that somebody's good quality radiographer at that point in time, you can get a job across, you know, one of the public, private enterprise and so on. So yeah, we've, again, one of the reasons I think why the course is in such high demand is that reason, that there's, you know, like I said, it's pretty much 100% employment rate.
Thanks, John. Yes, I think the next question you want to take as well is in regards to the average graduate salary.
Yeah, right. Okay, great question. You can actually go and look. There are public salary rates for the different levels of radiographer available through enterprise bargaining agreements and so on that are available through Victorian public agreement schedules. Now, what they are is a absolutely brilliant question, and I don't want to be taken out of turn, so I may just park that for a moment and just find the pay scales. The thing about radiography, I suppose, particularly to be cognizant of, is that we talk about a base salary. The base salary in the public agreement is in a public center where if you're a grade 1 or a grade 2 or a grade 3. Private enterprise, being private enterprise, can negotiate pay rates with people, of course, and will often offer people a higher pay rate. The reason being is they want to attract good quality radiographers there. In large public centers, you have overnight shifts that demand a penalty. They work on public holidays, which demand a penalty rate. They do on-call, which is, again, paid quite differently. A general rule of thumb for on-call is if you get called in to do a case and it's anything over an hour long, you will actually get paid time and a half to double time for a minimum of 3 hours. So in fact, when you look at that, it's something to be conscious of, that the base rate is a base rate and that there are these add-on items, I suppose, in that regard. Again, with a bit more kind of, because I have been through that whole thing, you have to be cautious that to maintain a pay scale that you've grown accustomed to as a new graduate, where you have a lot more energy and vim to work night shifts and out of hours and on call and so on, it can be quite a challenging thing to maintain throughout your career. If, let's say, I don't know, you have a family or you play football and so on, that all has to fit into that as well. So in regard to pay scale, it's hard to give a determinate figure when it's quite different in different places. All right, so hopefully that answers your question. In the interim, I can try and look up the
thanks John. Yeah, that's usually a similar response that we get when students ask about the pay scale for nursing graduates, for example. So yes, it really depends if you clock in additional hours, maybe overtime or weekend. So it does vary, again, depending on your workplace. All right, the next question we've got is in regards to, how you mentioned about, being data driven and if that may have an impact on, future job prospects.
Yeah, excellent. I'm happy to speak to that again if you wish. Like, yeah, I think every profession is cognizant of the encroachment, the growth of artificial intelligence. within radiography, absolutely right, that we understand that there's AI is growing absolutely exponentially. I think Laurie answered the question that
Yes, that's right.
radiologists who look at the data at that end of it. But again, we always look to AI as an adjunct, not a replacement. How can we use this to do our jobs better? Not how can we use this to replace our jobs? And I think that's really important. We look at within radiography, where is AI being used? AI is being used, for example, to generate workflow patterns. AI can look across the last 20 or however many years worth of data is available. And we look at we do 20-minute appointment times. It doesn't matter what it's for. And yet we know that, hang on, the data tells us that some appointments need longer. Some appointments need to be shorter. The hand x-ray on an ambulant patient is actually probably a 10-minute appointment time. So that's where we're really seeing this AI being brought into services. That is not replacing radiographers. That's just how much appointment time do you need to do this efficiently and well? And it's generating more efficiencies within our healthcare services. I guess from our perspective, an area where, again, it's like the manufacturers who, for example, look at how do we use AI to generate better quality images. They don't look to it to go, how do we use AI so that we can get these radiographers off the wagon? It's not used like that. It is never seen as that, and I don't believe will ever be perceived as such. Even from the radiologist perspective, what it's doing, because it's being used already as an adjunct to their reporting. In Alfred Health, you can go onto the internet and check up Bang Law, I think is the person's name, and they use it to basically go, it flags to radiologists, this has something suspicious on it. You should report that first. So it does workflows and so on. So that's, I think, is a really important point as we look at this. How do we use AI to benefit what we can do? And if we can be more efficient, let's say in our examinations and so on in radiography, well, that's fine. We can focus on patient care aspects here and do that a lot better. So that's hopefully that answers the question. I don't, nobody,
Yes.
I think as we've gotten more and more sophisticated and a bit more kind of level in regards how we perceive AI, we're looking at it's an adjunct. It helps us to do our work better. It doesn't replace what we do. And I think,
All right, thanks, John. Answered very well. Another common question we get from students who aren't too sure what they want to do, they are often confused between, like choosing between radiation sciences versus radiography. So what's the first response you would usually give to this particular group of students that aren't too sure which foot to go into? Perhaps Laurie? Yeah.
Radiation sciences and radiography are quite different. And I mentioned that in my presentation. Radiation sciences is really often a pathway to another course that will lead to working in a specific health profession. As John mentioned, when you graduate from radiography, you can enter the workforce. You become a member of APRA and you can be registered and you can start working once you graduate. So they are quite different in that respect. For radiation sciences, most of our students go on to another postgraduate course, radiation therapy. About half the students do that, and the other ones are there as options. If students choose not to go on to another course afterwards, they can work. There's lots of jobs in hospitals that require a degree perhaps, but you're not a health professional per se, such as a nurse or a radiographer. You can work in research as well. So those types of options are there.
Thanks, Laurie. All right, the next question we've got is in regards to getting into ultrasound data. So what are the necessary next steps if students are looking to become a specialist in ultrasound?
Yeah, ultrasound, and I see one question there. Ultrasound is a postgraduate course, so you do need to have an undergraduate degree to enter the Masters of Medical Ultrasound. One of the things with ultrasound, though, is that students do have to find their own clinical placement site, and that is quite challenging. John mentioned that lots of radiographers go into that, and that's because they often have been working in the profession for a little bit. They already are in a clinical site, and that clinical site may sponsor them to do ultrasound. So they can do their training, their clinical training at that site. But if you don't have that connection, it can be very difficult. So we always want to warn our students of that. That's the way it is at Monash. And if you're not already a radiographer or some health professional, it can be very difficult to find a clinical placement.
All right, thanks, Laurie. John, have you got anything else to add?
Yeah, no,
to
that was going to be my point. Like, certainly, you know, there is one ultrasound course in Queensland that does actually have clinical placements for students, but otherwise that's, I think, is the challenge, and hence historically it has been, you know, mostly radiographers who will go into ultrasound. Well, particular streams of ultrasound. There are different streams of ultrasound as well that one can do in postgraduate. There's vascular ultrasound, which actually tends to be sports physiologists and so on who will go into that. There's cardiac ultrasound as well. So there are different I guess what you might call subspecialities within ultrasound, but the general rule of thumb for those who go into general ultrasound are most often radiographers, and that's, Laurie has outlined that really, really clearly, that can be a challenge. In effect, if you're not involved in a radiography department, you have to in effect get and cold call imaging facilities and ask would they be willing to sponsor sort of your or support, I suppose, your learning ultrasound. So yeah, so it is a challenge.
All right, thanks, John. One of the questions in the chat was in regards to placements during the degree. Would you maybe want to touch a bit on, you know, if there's any flexibility in regards to placements, and so what happens after those placements? Like, would students, you know, have a chance of, you know, potentially working in that area once they graduate?
Yeah, thanks. I'm happy to field that one, I suppose. Yep. Yeah, thanks, because we do the placements more traditionally. What we talk to placements, we don't do electives, we do placement schedules. And certainly in regards to flexibility, they can be quite inflexible because clinical placements are challenging and difficult. And the hospital sites, you know, each year we would go out and go, these are our dates that we would hope to do our clinical placements in, and they talk to the academic calendar and so on. Also, just and one item is that the clinical placements generally happen outside of kind of academic calendar, so therefore, you know, summer holidays can be a bit truncated and so on. So I think that's an important item for students with regards to looking forward to radiography in particular. Like, we don't run to a normal university schedule because of clinical placements. For example, if we look at the year 4 clinical placements, they in effect kick off on the 9th to the 10th of January. And run 24 weeks, and then the academic block runs right down into the middle of December. So that's one item. In regards to the second part of that question, you know, does it then lead to opportunities? 100%. They will. We always talk to that, the fact that I guess when you get out on clinical placement, leaving a good impression in that site is you know, it can be your, I suppose, shoe in to getting gainful employment and so on within that site. In fairness, and I think Nicole would maybe speak to that. In year 3 into year 4, particularly in our course, we don't actually allocate people to clinical placements. Most sites will actually go, we want to interview students, or we want to see their CVs and so on. And you find even in some instances go, you know what, I actually don't need your CV. You came here last year, ergo here's an offer for you on the table. So really, really important, I think, in that regard, that one puts the absolute best foot forward when you get out onto clinical placement and all of the things, you know, associated with being professional, like showing up on time, ensuring that you're, you know, kind of look presentable, etc. is really important. But also being, I think, really engaged in the clinical placement experience is really, really important. Like I said, just showing up and with a vim and a vigor and an eagerness. So yeah, absolutely key. The very important points in regards to that question. So thank you. It's a good one.
Thanks, John. Nicole, have you got anything to add in regards to the later years of placements and, you know, how it works and everything?
Yeah, I guess in regards to the internship, so that 6-month block of placement, I guess what I'd recommend is, so I actually, I guess seeking out part-time jobs related to the medical field or imaging potentially. For example, at the end of year 2, I found a job as a medical imaging assistant at a public hospital, and that really helped me land a internship where I wanted to as well, and also just helps you gain really good clinical skills in addition to the ones that you learn at uni as well.
Thanks, Nicole. All right, the next question we've got is in regards to ultrasounds for pregnancy. Perhaps, Laurie, you would just want to answer that instead of typing away. Maybe easier.
Yeah, I'll answer that. What I was saying was that's a job of an ultrasonographer. That's a big part of what they do is ultrasound for pregnancy. So you need to go through an ultrasound course if that's what you want to do when you finish. And as we mentioned, radiography is probably the best way to get into the Master of Medical Ultrasound at Monash. So do that course first and then go into ultrasound, and then you will be able to do ultrasound for pregnant women.
All right, thank you, Laurie. The next question we've got is pretty specific. So if a person has already graduated as a radiology technologist in another country and they have about a year of experience, is there any chance at all of, transferring or getting any credits recognized?
Yeah, thanks, man. Sure, I can feel that. I'm not the expert in the area, but I know how it works. What is there is a particular mechanism, I suppose, for assessing people who have studied radiography in another country. And it's, I would say, quite rigorous. It can be quite challenging to maybe particularly at Monash. I guess need to recognize that Monash as a G8 university in this part of the world, lots of other qualifications unfortunately don't meet the sort of standard, I suppose, of what we refer to as AQF level 8 qualification. So yes, it will be assessed, evaluated and appraised. We have found that it's fairly rare for anybody to get anything more than maybe a semester, and even then would be a stretch across again how we look at radiological physics and safety, biology and radiographic science practice. It's challenging, but certainly is, if you have done that, we are certainly would be more than willing to entertain the notion of evaluating your prior qualifications and so on, certainly. But again, hopefully that answers your question. Yes, it's potential, but I notice your question by years. I have never seen it happen actually, where we would look and go, yeah, that is commensurate to what we do at year 1 and year 2 level here. So I have, never almost seen that be done before, even within other universities within Australia, where we're kind of it likewise is equally quite challenging because there's only 2 universities in Monash that have that AQF level 8 qualification.
All right, thanks, John. The next question I've got is perhaps for Mackenzie, and maybe Laurie could tap in as well. Mackenzie, so in regards to your master's degree, what would you say the proportion of students are that were from radiation sciences at Monash?
I think there's maybe around 20, a bit over 20, and maybe 5 or 6 of them are from other courses. So things like maybe biomed, and then the rest are from my cohort, so the radiation sciences cohort. Yeah.
Oh, so quite a fair bit of students from the undergrad would then go on to the postgrad.
Yes, yeah, quite a few.
Yeah, because one of the very common questions we get asked is, what's the likelihood of students being actually guaranteed a spot in the postgrad degree?
So when Laurie had her big screen up with all the units, you do have to do certain electives because they're prerequisites for the masters. And then there's a grade point average that you have to achieve. And there's like a minimum score for that. And then after that, they just pick the people that meet that requirement. And then I think probably Laurie can add on to this, but yeah, that's how it worked for me.
It is just on your grade point average. They look at the minimum score you have to meet to get into that. And if students are just ranked and they're accepted based on rank. But one thing I can tell you is most of the students who do want to get in and apply do actually get in. We actually usually take about 30 students into the pathway to radiation therapy. And some students change their mind and decide they want to pursue something else. So that would be why the number is often 20. One thing to note is there is a shortage of radiation therapists across Australia right now, and lots of cancer centers open. So that number may actually be increasing in the future because there are other states in Australia that are looking to our course to potentially take our students and do the clinical training at different places.
Thanks, Laurie, and Mackenzie. All right, looks like we are done with questions. So before we conclude, Nicole and Mackenzie, have you ladies got anything to add in regards to, tips or advice for future students that are considering a degree or career in either of your areas? Nicole, have you got anything to add?
I think, like I said before, it would be good if you could get like a work experience block while you're in high school, if you want to get a really good insight into what the career is about, because I know radiography is a little bit more niche and not as many people know about it compared to maybe nursing or medicine. But yeah, also maybe talk to current students or current radiographers that you might know to ask about their insights and how they're finding the job as well. Yeah.
Thanks, Nicole. Very helpful. And Mackenzie, yourself.
Oh yeah, I agree with what Nicole said. Because it is quite a niche area of healthcare, just do your research. There's lots of resources available out there, especially for radiation therapy, because I didn't really even know what it was before I came to uni. And yeah, just come to events like this, come to the open days where there'll be students and staff there where you can ask questions about it.
Thanks, Nicole and Mackenzie. All right, so we'll conclude today's session. And like what Laurie has mentioned earlier on, definitely come to open day this August. You get to see our beautiful facilities, our campus, as well as meet our students to really hear about their student experience and student life. All right, that concludes today's session. It is being recorded. The recording will be posted on our study pages about a week to two after today's webinar. Thank you, everyone, and have a good evening.